I start. Good afternoon. Thank you all for joining in this webinar session. Myself, Mrs. Pooja Mondal, Assistant Professor of Optometry Department, TIPS. My warm greetings to Honorable Chief Guest, our respected Principal Madam, all the dignitaries, other faculty members, healthcare professionals, and all the students present in this webinar. Today's webinar hosted by me and my colleague, Mrs. Momita Mujumdar, Assistant Professor of Optometry Department. 23rd March marked as the World Optometry Day, and the following week is celebrated as the World Optometry Week. This day is generally celebrated to create awareness about optometry as a profession. An optometrist is an eye care professional who provides comprehensive eye and vision care, which includes refraction, dispensing, diagnosis, and management of the diseases of eye. They also provide specialized service like contact lenses, vision therapy, sports vision care, low vision care, pediatric and geriatric eye care. Every year, Tripura Institute of Paramedical Sciences celebrated this day by organizing rally, survey, free eye checkup camps, and with scientific session and all. Due to this ongoing pandemic situation, this year we are celebrating it through online mode. On behalf of TIPS, I would like to wish you a very welcome to this live webinar session, and also wishing you a very happy World Optometry Week. The eye is highly vascularized tissue that is in very close proximity to the sinuses and the brain, which makes it an easy entry point for viruses. As a result, COVID-19 may enter the body through the eyes and then spread to the whole body through the blood vessels within the conjunctiva. As the COVID-19 situation continues to evolve, patients continue to look to optometrists, the primary eye healthcare practitioner, for accurate eye healthcare and vision guidance. Tripura Institute of Paramedical Sciences is looking forward to support the health and safety of the public and the optometrist community, and will continue to assess the situation to ensure everyone to understand the risk associated with this pandemic. So today, our topic of the webinar is effect of COVID situation in optometry practice. I would request my co-host, Mrs. Momita Mujumdar, to take over from here. Thank you.
Thank you, Pooja Madam, for the commencement of our.
This webinar has been organized by the Department of Optometry, Tripura Institute of Paramedical Sciences, to commemorate the World Optometry Day 21. I specially welcome Professor Biswajit Mondal.
Is my slides are visible?
Yes, sir.
Yes, sir.
Great.
Yes,
Thank you very much.
Yes, sir.
Yeah, before I start talking on my topic, let me thank Dr. Devashish Mondal for his kind invitation to and offering me this wonderful platform. And I'd also like to thank Principal Madam of this TIPS, Tripura Institute of Paramedical Science. And This is really wonderful that I'm sharing your platform. And as I have seen for last many years that you all, this team Optometry tips celebrates World Optometry Week rather than the World Optometry Day. Probably we all celebrate it like just a World Optometry Day, but I have seen Tripura, the tips always celebrate World Optometry Week. So this is really a wonderful initiative to create awareness about optometry in a community. As you all know that many among us or many amongst people, those who are not aware about our profession, even though they might have visited us, but even after leaving us, they do not know they visited an optometrist. Yeah, the is effects of COVID situation in optometry practice. Then I found this is really a very relevant, and at this moment, this is the topic which we all are talking. Yeah, we remained all so enthusiastic about the year of vision, as all optometrists know that this Vision 2020 in Wuhan, China, in December 2019, and it has since spread rapidly across China, the Europe, North America, and the other parts of the world. COVID-19 was declared a public health emergency of an international concern on January 30, 2020, and is now a pandemic. With COVID-19 sending the world into lockdown, the main objective for many is simply survival. Thus, in spite of high hopes for the year of optometry, 2020 has quickly become the most challenging time the profession has ever faced. Hopefully, the COVID-19 curve will flatten with social distancing, and several potential treatments are in the works. Optometry practices will survive this period and be stronger because of it, but there is no denying the challenges. COVID-19 is not an extinction event for optometry, but that doesn't diminish its stressful and humbling effects. The post-COVID-19 landscape is bound to change many facets of eye care, including consumer behavior, business strategy, and practice operation. What follows is a view into each of these windows of what may lie ahead. And what's next? See, even before whatever challenges we face in our life, um, initially it takes time to accept. But for that, we understand that we do not have any other choices except accepting the fact. Yes, we have to accept, we need to adapt, and then we have to fight for overcoming. So the effort of re-engaging with patients while maintaining healthy margins is reshaping the optometry practice. And here, optometry practice in new normal, there are many guidelines has been given by different associations, different professional bodies, organizations. Here are COVID-19 guidelines for optometry and optical service post-lockdown. Even need to think even about the operating procedures. They spontaneously, their eye, hands, and everything is very coordinated. And so just they start practicing, and then it's all become very spontaneous things for them. But yes, today we need to add few more steps to ensure health and the safety margin. So here are the guidelines for optometry clinics. That is this piece for optometrists is mask, face shield, safety goggles, and gloves, and disinfectant that can be used: soap, water, the sodium hypochlorite, and then hand sanitizer, surgical stick. So these all has to be added in a day-to-day. They gone out of your office, somebody else could have been come, but now one patient after he moving out of your office, your staff need to clean all equipments need to be sanitized, and then the other patients may visit. Patient examination. Minimizing a comprehensive eye examination time, maybe 20 minutes. It is again a guideline given by, I've seen in a paper, publications published by this some eminent professionals, that and it facilitates ventilation of examination room. If the room is air conditioned, clean and disinfect the filter at regular interval. Wash and of course with soap. Ophthalmic instruments need to be disinfected after every use, like forehead rest, chin rest, knobs, etc. Any equipment, touching patients need to be sanitized or need to be disinfected. And the contact lens guidelines are, there is enough evidence to suggest that contact lenses are safe to wear during COVID-19 times. The contact lens clinic essentially should function as before, with reinforcement of the care and maintenance instruction, hand washing with soap and water as contact lens hygiene, including the work surface disinfection, were always a part of safe practices in handling contact lenses. And contact lens care and maintenance in the clinic, the solution bottle should be wiped clean with a sanitizer when handling by any patient. Solution should be discarded every morning and a fresh solution to be used every night. Contact lens case most often is the weakest link when it comes to safety chain of contact lenses. All contact lens accessories, suction cup and holders, plungers, etc. need to be cleaned with a soap and water and replaced periodically, and if possible, their use may be avoided. Pediatric optometry and binocular vision or vision therapy guidelines, apart from physical distancing, hand hygiene, administration of the COVID-19 symptoms checklist and disclaimer, use of personal protective equipments, including compulsory masks for the children, and attendant is to be ensured. Vision and vision therapy guidelines. Yes, here history taking, although history taking is an important component of binocular vision or orthotic clinic workup, it is important to reduce the time taken for the self. And the history can be recorded over phone, or the symptom survey can be emailed if the patient have prior appointments and email access. Vision therapy. In a regular optometry clinics where infrastructure support is not available to maintain physical distancing during in-office vision therapy, software-based home therapy should be in general. Software-based home vision therapy options can be explored towards providing television therapy consultation and management. Low vision practice guideline, as we know that in low vision evaluation, it takes a huge time to interact with the patients and to finally identify. When a patient's presence in the clinic, only those clinical tests that are must, for example, high contrast distance visual acuity, binocular near visual acuity should be performed. And low vision practice guidelines, instructional videos for it makes a rehabilitation training or the use of a device. It takes many minutes to make them understood, to make them accustomed with the new equipment and new devices. But here we can do that. Instructional videos, writing instructions, and follow-up using teleconsultation may help to minimize the duration of training. Teleconsultation can be considered in those patients where the vision is stable. Clinical low vision examination was done within 1 year, and the patient doesn't report any new functional limitations. So we may go with that. And the conclusions are, even before we conclude, even it is the professionals has faced many challenges during COVID-19. Still we are facing that all challenges. Even we have learned many things during this period of time, and before even we have seen that during lockdown also, maybe there are some of the practitioners who has worked standing in front line and those are practitioners. So here the optometrists, being primary healthcare professionals, of infection and source of transmission of the disease. This guideline provides a ready reference for optical store, even an optometry practices as preferred practice guideline in COVID-19 or pandemic situation. How long this new protocol will be needed until there is a lower rate of transmission or a vaccine become widely available? They seem prudent for the near term. Back to practice won't mean back to normal. And even for detailed guideline, you can refer these all pages I have checked. So you also can visit where you'll be getting detailed guideline for individual specialty practices. And one among is this Turakia is Shaoji and Mr. Goel and et al. Their guideline is COVID-19 guideline for optometry and optical service post-lockdown. It is published in Indian Journal of Ophthalmology, which is a wonderful piece of publications you will get, where you'll be getting all details about the do's and don'ts during your practice at this new normal situation. Thank you.
Thank you so much, sir, for your inspiration and valuable words. And we all try to maintain all the guidelines. Thank you, sir. Yes, in this COVID situation, from the very beginning, every frontline workers and as well as optometrists also has endured a lot of hardship and they are fighting continuously still. I sincerely hope that the world recovers soon from this malady that has claimed so many lives, and on behalf of TIPS, we salute all frontline workers from the heart.
Your valuable attention and also suggesting with our opinion. It's my pleasure to have been asked to propose a vote of thanks on this occasion. Thank you so much. Thank you.
Thank you so much, sir, and thank you all for joining us at our session. Thanks a lot. Namaskar.